As we age, our bodies undergo silent but profound changes. One of the most noticeable and often overlooked changes occurs in the skin, our largest organ, which serves as a protective barrier and mirror of our internal health. Itching, also known as pruritus, becomes increasingly common with age. But why does this happen? The answer is neither simple nor unique, but involves a combination of physiological, hormonal, and even emotional factors. As we age, our skin loses some of its ability to retain water. This is because the sebaceous and sweat glands, responsible for producing natural oils and sweat, become less active. As a result, the protective layer of the skin, called the hydrolipidic film, weakens, leaving the skin drier, rougher, and more susceptible to irritation. This dry skin, called xerosis, is one of the main causes of itching in older people. What was once supple, moisturized skin becomes thin, fragile, and less elastic. This new skin texture, combined with dry weather or the use of harsh soaps, makes elderly skin extremely sensitive to touch, heat, and chemicals, which increases the risk of constant discomfort and itching. Another important factor is the slowing of cell metabolism. Over the years, the skin cell renewal cycle slows down. This causes dead cells to remain on the skin's surface for longer, contributing to the accumulation of fine scales and clogged pores. This accumulation, in addition to increasing dryness, can cause local inflammation and, consequently, a persistent itching sensation. In addition, the immune system also undergoes changes. Immune aging, called immunosenescence, reduces the body's ability to respond to external aggressions and allergies. Thus, small reactions that would go unnoticed in younger people can cause great discomfort in older individuals, with symptoms such as redness, flaking, and intense itching. There are also hormonal aspects involved. The production of hormones such as estrogen and testosterone decreases significantly with aging, and these hormones play a key role in skin hydration and structure. In women, for example, the drop in estrogen during menopause is directly linked to collagen loss and decreased natural oiliness, which further accentuates the feeling of dry and irritated skin. In men, the gradual decline in testosterone also affects the skin's resistance to friction and sun exposure, making it more vulnerable to dryness and chronic itching. In addition to physical and hormonal factors, we cannot ignore the emotional and neurological aspects of aging. It is common for older adults to suffer from anxiety, stress, insomnia, or even depression, conditions that can intensify the perception of itching. This is because itching also has a neurological component. There are situations in which itching arises without any apparent lesion, merely as a result of changes in the skin's nerve receptors. In some cases, the brain interprets certain stimuli, such as heat or simple friction with clothing, as an itching sensation, even in the absence of a real physical factor. This is especially common in older adults with neuropathies or degenerative diseases. It is important to remember that itching is not just a passing nuisance. In older adults, it can affect sleep quality, cause irritability, compromise self-esteem, and even open the door to secondary infections caused by constant scratching of the skin. What starts as mild discomfort can progress to more serious lesions, bleeding, and skin infections, especially when there is no proper skincare routine. Therefore, understanding the root causes of age-related itching is the first step to treating it effectively and restoring the well-being and dignity of those who live with it. As the skin ages, it reveals signs of wear and tear that often go unnoticed in everyday life. One of the most uncomfortable is itching, which can affect different areas of the body intensely and persistent. What many people don't know is that itching in older adults does not occur randomly. There are areas of the body that are more susceptible, both due to physiological factors and anatomical and environmental issues. Knowing these high-risk areas is essential to prevent complications and ensure comfort and well-being as the years go by. The first area worth mentioning is the scalp. With aging, the scalp tends to dry out due to decreased activity of the sebaceous glands. This means that the natural oily layer that protects this area becomes scarce, leaving it vulnerable to irritation. Frequent sun exposure, the use of harsh shampoos, and even accumulated sweat can aggravate this condition. For many older people, itching in this area is so intense that it can cause flaking, small wounds, and even hair loss. In addition, as the scalp is difficult to see without help, these lesions can go unnoticed for too long, becoming a gateway for bacterial or fungal infections. Another area that is extremely affected is the back, especially between the shoulders and the lower spine. This area has a large number of nerve endings and, paradoxically, is one of the most difficult parts of the body to reach with the hands. Therefore, itching on the back can cause frustration and lead to the use of improvised objects to scratch, brushes, handles, even corners of walls, which only aggravates the situation. In addition, constant friction with clothing, especially synthetic fabrics, can cause microlesions on already fragile skin, intensifying itching and creating a cycle of discomfort and continuous irritation. The legs, especially the shins and ankles are also among the areas most affected by itching in older adults. This area is often exposed to dryness due to reduced peripheral blood circulation, which increases with age. Many older adults also suffer from varicose veins or venous insufficiency, which further compromises oxygenation and hydration of the skin in the lower extremities. The result is thin, brittle skin that appears scaly and extremely sensitive. In cold or low humidity environments, this condition can worsen, causing painful cracks and a constant burning and itching sensation. The arms, especially the outer part of the forearms and elbows, are another common focus of itching. This area is in direct contact with surfaces, clothing, and the sun, which promotes dryness and irritation. Many older adults develop a condition called actinic prurigo, an exaggerated sensitivity to the sun that causes small red lesions and intense itching, usually on the arms and face. In addition, the simple habit of rubbing the arms or scratching the area during sleep can lead to crusting and secondary infections. One of the most delicate areas that requires special attention is the foot region. The skin on the feet ages more slowly, but suffers from constant friction when walking, wearing closed shoes, and poor circulation. This contributes to the appearance of cracks, calluses, and fungal infections, such as chilblains, which cause intense itching. In many cases, the presence of fungal infections on the feet goes unnoticed or is treated improperly, aggravating the condition. In addition, diabetic patients, who are numerous among the elderly population, may develop peripheral neuropathy, which alters the perception of sensations and can cause phantom itching, that is, itching with no apparent cause. Last but not least, we have the intimate region and areas with folds, such as the armpits, groin, and under the breasts. These areas are prone to heat, sweat, and moisture buildup, creating the ideal environment for fungi and bacteria to proliferate. Itching in these areas can be caused by contact dermatitis, candidiasis, or even allergic reactions to hygiene products. In the case of bedridden or mobility-impaired elderly people, the lack of adequate ventilation in these areas can cause severe irritation, rashes, and recurrent infections, which are often silent as they are not always verbalized due to embarrassment or discomfort. In many cases, itching seems like a minor issue, daily passing discomfort, something common that anyone feels from time to time. Scratching your arm, leg, or head may seem harmless, but when it comes to the elderly, extra attention is needed. What seems like simple discomfort can actually be a sign that something deeper and sometimes serious is happening in the body. Persistent itching, whether localized or generalized, can be the first silent warning sign of systemic diseases that go far beyond the skin. And it is precisely because it is silent that it is often ignored, until the consequences become too visible to ignore. One of the first warning signs that itching can give us is related to liver function. Liver diseases, such as chronic hepatitis or cirrhosis, often cause itching all over the body, especially on the palms of the hands and soles of the feet. This happens because when the liver is not functioning properly, it allows bile substances to accumulate in the blood, which end up being deposited in the skin and activating receptors that cause the itching sensation. Interestingly, in many cases, this itching appears even before other classic symptoms such as jaundice, the yellowing of the skin and eyes. Therefore, when an elderly person reports persistent itching without an apparent cause, especially if accompanied by fatigue or changes in the color of stool and urine, it is essential to investigate liver function. Another condition often associated with itching is chronic kidney failure. When the kidneys lose their ability to filter blood properly, toxins build up in the body, also affecting the skin. This itching, known as uremic pruritus, is usually widespread, intense, and worse at night, which compromises sleep and well-being. The skin may even appear healthy at first glance, but the internal discomfort is real and distressing. In many older adults with kidney disease, itching is one of the most debilitating symptoms and, unfortunately, also one of the most underestimated by patients themselves and even by healthcare professionals. In such cases, scratching does not solve the problem. The root cause must be treated. Diabetes is also among the main hidden culprits behind chronic itching. In older adults, type 2 diabetes can develop silently over the years and often manifests indirectly. Dry skin, common in diabetics, increases the risk of fungal and bacterial infections, especially in moist and folded areas such as the armpits, groin, feet, and intimate areas. These infections cause intense itching, flaking, and even painful cracks. In addition, diabetes can cause diabetic neuropathy, nerve damage, which alters how the brain perceives sensations on the skin. Instead of feeling pain or heat, the patient feels itching, tingling, or even burning, and because sensitivity is compromised, they may scratch intensely and unconsciously, leading to serious lesions. Thyroid disease is also often linked to itching, especially hypothyroidism, which is common in older adults. With reduced thyroid activity, metabolism slows down and the skin becomes drier and thicker. This condition favors the onset of persistent itching, often accompanied by a feeling of cold, tiredness, and weight gain. Because it is a silent and slowly progressing disease, hypothyroidism often goes unnoticed, and itching, which could be an early warning sign, is treated only with creams and ointments, while the underlying cause remains active. In addition to internal diseases, it is also essential to consider that some itching may be caused by reactions to medications. Older adults often take several medications daily for blood pressure, cholesterol, pain, anxiety, sleep, among others, and the combination of these substances can trigger allergic skin reactions. Sometimes the medication is new. Other times, the itching appears even after years of use due to changes in the metabolism of the elderly body. In these situations, the itching may be accompanied by spots, redness, or just a diffuse burning sensation and discomfort. In these cases, it is essential that the medication history be carefully evaluated to identify possible hidden causes. We cannot fail to mention hematological diseases such as lymphomas and leukemias. Although less common, these diseases can initially manifest as intense and unexplained itching, often without visible lesions. The itching associated with these diseases is deep, diffuse, and resistant to topical treatments. In some cases, itching can be triggered by the heat of a bath or intense emotions, making it even more difficult to control. When itching persists for weeks or months, even with proper dermatological care, it is essential to investigate deeper causes with blood tests and specialized medical evaluation. Itchy skin, especially in older adults, can seem like a difficult battle to win. But it is important to remember that the solution is not always found in expensive medications or complex treatments. Often, relief begins with simple, everyday, and above all, consistent gestures. The skin of older adults is as delicate as a sheet of old paper, marked by time, sensitive to touch, and at the same time full of stories. Taking care of it is an act of respect for one's own journey. The first step is to understand that the skin needs constant hydration, even when it appears normal. The vast majority of people only resort to moisturizing creams when they feel discomfort, but at this stage of life, it is precisely preventive care that makes all the difference. Using a good moisturizer every day, preferably right after bathing, when the skin is still slightly damp, helps keep the skin's protective barrier intact, drastically reducing the chance of dryness and itching. Another fundamental care tip is the temperature and duration of showers. The habit of taking very hot showers, although pleasant, is highly detrimental to aging skin. Hot water removes the natural layer of oil that protects the epidermis, leaving it exposed and vulnerable. Warm, quick showers with mild, unscented soaps are one of the most effective and easy changes to implement in your routine. Glycerin soaps with a neutral pH are best, as they clean without harshness. Harsh sponges, so common in younger people's baths, should be avoided. They hurt, remove the skin's protective layer, and can cause micro cracks, opening the way for infections. Drying should also be done gently, pressing the towel softly against the body and never rubbing. Clothes that come into direct contact with the skin also play an important role in this scenario. Synthetic fabrics with artificial fibers such as polyester or nylon can irritate the skin and aggravate itching. It is best to always choose cotton clothing in light colors that allow the skin to breathe. In addition, it is essential to avoid using fabric softeners and perfumed soaps on underwear and bedding, as their chemical residues can cause contact allergies, especially on more sensitive skin. Changing clothes regularly, including pajamas and pillowcases, helps maintain skin hygiene and reduce the risk of contact with irritating substances or accumulated microorganisms. Dry environments can also intensify itching. Therefore, maintaining balanced humidity levels indoors can provide significant relief. In drier climates or during winter, using air humidifiers or even containers of water near heat sources, such as heaters, can help reduce skin dehydration. Adequate water consumption is also crucial. Many people believe that because they don't feel thirsty as often in old age, they don't need to hydrate as much. But the body continues to need fluids to maintain its vital functions, and that includes skin health. Encouraging the habit of taking small sips of water throughout the day, even when not thirsty, is a practice that over time directly reflects on the appearance and comfort of the skin. Emotional care should also go hand in hand with physical care. Stress, anxiety, and loneliness can amplify the perception of itching, making it more intense than it really is. The skin is, in a way, a mirror of the soul. When the inside is in conflict, the body speaks, and often it speaks through itching. Activities that promote emotional well-being, such as light walks, leisure time, reading, music, or even meditation sessions, can have a surprising effect on reducing physical discomfort. In some cases, the simple act of distracting yourself, of shifting your focus away from the itch, can help break the cycle of irritation. There are also small gestures that may seem obvious, but make all the difference in daily care. Keeping nails well trimmed and clean prevents deep wounds from scratching. Encouraging the use of thin cotton gloves for sleeping can help prevent unconscious injuries during the night. And never underestimate the power of observation. Each new spot, flaking, or change in the pattern of itching should be monitored closely, not with fear, but with the care of someone who listens to their body and respects its signals. Caring for your skin in old age is much more than a cosmetic issue. It is an act of kindness, a daily commitment to comfort, dignity, and overall health. There is a wisdom that cannot be found in books or acquired in the most renowned courses. It is the wisdom that only time can offer, which matures along with life, patiently accumulated in gestures, subtle observations, and daily experiences with those who have entrusted their bodies and stories to someone who decided, while still young, to take care of the health of others. It is from this place of humility and listening that the advice of an 85-year-old doctor speaks. A man who has seen generations grow up, who has held trembling hands, who has listened to the most intimate confessions, and who has learned that in the end, true medicine begins with looking, continues with listening, and concludes with caring. When this doctor tells us not to ignore itching in older people, he is not just talking about skin, he is talking about everything that lives behind it. For this doctor, itching has never been just a symptom. It has always been a sign of something bigger, a physical expression of discomfort that often even the patient cannot name. He says that over the years, he has learned to pay attention to small complaints, those that, in a busy office, could easily be overlooked. The itching that appeared every night at the same time, the redness that never went away, the discomfort that no one took seriously. How many times, he says, has he seen patients who lived in silence, enduring the itching as if it were a natural burden of age, people who had become accustomed to the discomfort, as if feeling bad were an inevitable part of aging. But he never accepted that. For him, aging is not getting sick, it is changing, and all change requires attention and respect. He often says that the skin speaks what the soul silences, and perhaps that is why whenever an elderly person told him about itching, he would stop to look deeper, not just with his stethoscope, but with his heart. Often, the cause was simple: an allergy, an unsuitable soap, an environment that was too dry. But other times, he knew that the itching hid something deeper: a tired liver, overworked kidneys, silent diabetes, a heart that beat well but carried sadness. And there was yet another type of itch, the one that came from loneliness, anxiety, lack of touch, absence of conversation. He says that many patients improve just with a little more care, a little more presence, a little more listening. The advice he gives today with 85 years of experience is not complex. He talks about the value of routine, constant hydration, choosing the right soap, taking warm showers instead of hot ones. He talks about the fabrics that touch the skin, the value of light clothing, the importance of letting the sun caress the skin with care and respect. But above all, he insists on one point: don't normalize discomfort. He asks family members to observe more closely, caregivers to ask more often, and the elderly themselves to listen to themselves more tenderly. Itching is the body's cry for care, he says, and every cry deserves a response. In his reports, he recalls patients who, after years of living with itching, smiled again after small adjustments to their routine: a new cream, natural soap, a room with more humidity, one less shower per day. Simple things that completely changed someone's daily life. But he also remembers cases where itching was the first sign of serious illness, and thanks to attention to detail, it was possible to diagnose it early. For him, the key is in listening to the body, listening to the skin, listening to the story that each symptom carries. He likes to repeat that aging is not a sentence of discomfort, but a phase of delicacy, and delicacy requires presence, care, and patience. His advice carries this tone: the lightness of someone who has seen a lot of pain and discovered that relief begins with respect for small signs. He does not believe in miracle formulas or quick fixes. He believes in the power of gestures repeated with love, in hands that apply moisturizer with care, in the attentive gaze that notices redness that previously went unnoticed, in conversations that allow the elderly to say where it hurts, where it itches, where they need attention. Because often what itches on the skin also aches in the heart. The skin keeps everything. Every mark, every line, every change that happens on it is like a silent record of the life that has been lived. When you look at an elderly person's skin, what you see is not just tissue worn by time, but a detailed map of stories, of sunny days, of hugs received, of worries overcome, of unexpected laughter, and also of discreet tears. The skin is the first thing to protect us when we are born, and curiously, it is also the last to resist when we begin to depart. That is why it deserves so much respect. And that is why when we talk about itching, dryness, or skin discomfort in older people, we are actually talking about something much bigger. We are talking about dignity. Dignity is not just the absence of pain. It is being seen. It is being cared for. It is having the details of life recognized with attention. When an elderly person feels constant itching, when their skin burns or cracks, when the discomfort repeats itself day after day and no one asks, no one notices, no one listens. Something more than the skin is being neglected. The story behind that body is being forgotten. The presence of that person as someone who still feels, still needs, still deserves care is being erased. Aging with dignity is having the right to continue to be treated with affection, to be heard in small complaints, and attended to in details that may seem insignificant to others, but that make all the difference to those who live there. Caring for the skin in old age is not just a matter of health, it is a gesture of love. Love for those who are before us today, but also for everything that person represents. An aging body is not a fragile body, it is a wise body. It shows us with its changes that life goes on even if at a different pace, and it teaches us that there is beauty in slowness, that there is value in subtlety. Gently applying cream, choosing lighter clothing, offering a warm bath at the right time, all of this is much more than physical care. It is an affirmation that that person still matters, that they still deserve comfort, still deserve choice, still deserve to be treated with kindness. In many homes and institutions, it is common for itching or skin-related complaints to be seen as things of age, as if they were normal, expected, and therefore irrelevant. But this thinking needs to change. When we normalize discomfort, we allow silent suffering to take hold. Itching that keeps you awake, that irritates, that causes bleeding, that tries your patience, all of this is avoidable. All it takes is to look more closely, to listen with more empathy. And empathy does not come from rushing. It flourishes when we take time for others. It comes from truly listening, from touching with care, from a commitment to well-being, even in the smallest details. The skin is also often the only means of expression left to some elderly people. When speech fails, when memory fragments, when the body no longer obeys as it once did, the skin continues to speak. It itches, it burns, it signals. Therefore, every irritation, every redness, every small lesion should be seen as a form of communication. Ignoring these signs is silencing a voice that still insists on being heard. Treating the skin is giving older people the right to continue to exist in comfort, with care, and above all, with respect for their history. When we look at an elderly person with this perspective, the perspective that sees beyond age, beyond appearance, beyond limitations, we are affirming something powerful, that every stage of life has value, that every human being at any stage deserves to be cared for with attention and humanity. The skin, with all its marks, is not a sign of weakness but of survival. It reminds us that there before us is someone who has lived through time, who has loved, who has suffered, who has lived, and that now, more than ever, they deserve the comfort that only true care can offer.